Hello and welcome to our channel. In this video I am going to explain about the bleeding from nose. Whenever there is bleeding from the nose, we call this condition in medical terminology as epistaxis. There are various causes of nose bleeding. People who have dryness of nose, irritation, and people with frequent nose picking, or if any trauma to the nose or any foreign body or intranasal mass in the nose, there are chances of nose bleeding. This nose bleeding is usually we come across in children of age 2 to 10 years or people who have high risk of contact sports, allergies, upper respiratory tract infection, and people who live in cold and dry environment, and people with frequent or forceful nose blowing, and certain blood disorders like hemophilia, von Willebrand's disease. People with old age group and pregnant women, there are high chances of nose bleeding. This nose bleeding can be of two types: anterior epistaxis, posterior epistaxis. Most commonly 90% there will be anterior epistaxis. In anterior epistaxis, the blood vessels in the anterior nasal cavity are disrupted, which results in the bleeding. This bleeding from the nostrils are rare. This is more common. Whereas in posterior epistaxis, the blood vessels in the posterior nasal cavity are disrupted, which leads to the bleeding. This bleeding goes down through the nose into the throat, and we can see the bleed in the mouth. This is most severe, and because of head or nasal trauma, we can see the posterior epistaxis. Usually the bleeding from nose will be controlled within 10 to 15 minutes. If at all the bleeding is severe and if it's not controlled, then we should consult the ENT doctor, where the doctor visualizes through visual inspection or endoscope. If at all there is hemophilia or blood disorders, then doctor suggests to get the blood test done. We can control the nose bleeding in home by using certain measures. First, we should sit or stand upright. After that, we should tilt our head forwards. Tilting the head forward prevents the blood draining backwards. So, after we tilt the head forwards, we should apply pressure underneath the nasal bones using forefinger and the thumb for 10 to 15 minutes. During this application of pressure, there may be difficulty in breathing, so the person should breathe through the mouth. Even after pressure application, if the bleeding is not stopped, we should apply ice packs. After bleeding stops, we should avoid blowing the nose forcefully, or we should avoid picking the nose, and also we should avoid drinking alcohol, hot water, hot soups, any kind of hot food we should avoid for at least 2 days. If the bleeding is severe and persists after 15 minutes, then medical attention is needed, where doctor manages this nose bleeding by using nasal decongestants which contain oxymetazoline, or applying packs of lignocaine and vasoconstrictor, that is topical anesthetic pack, or using nasal tampons, cauterization with silver nitrate, thermal cautery. With this process, doctor may do the treatment. This is all about the nose bleeding. Hope you like the video. If you like the video, please share and subscribe our channel. Thank you.